And today we'll talk about the CT diagnosis of Nutcracker. Probably, I believe many abdominal radiologists see cases of the Nutcracker through CT, and probably the abdominal radiologists who are doing Doppler ultrasound for CT is not quite common. And this was a young man with gross hematuria, and usually patient with hematuria, probably CT is the primary imaging technique rather than ultrasound. And this is a scroll image of this patient, and we clearly see the jetting of the contrast opacified left renal vein flow through the narrow space between the abdominal aorta and supraventricular artery, and we see the jetting of this contrast opacified left renal vein blood into the inferior vena cava. If we see this finding, like definite jetting, probably we do not need to do Doppler ultrasound. I think this CT finding is enough to make a definitive diagnosis of Nutcracker phenomenon. In this patient Doppler, the peak flow velocity was very high. This criteria is 100 centimeter per second. In this patient, 126. So this is the most typical. And this was paper written in 2011. And in this first, the early experience with the CT findings of Nutcracker, we tried to make a diagnosis of Nutcracker phenomenon by using these morphological changes of the left renal vein between the abdominal aorta and supraventricular artery, like this big, like this clubbed narrowing or smooth tapering. And we try to categorize this and suspect Nutcracker if the CT shows big sign. And actually the sensitivity and specificity was quite high. But one thing is that the CT is the usually we do in patients with breath holding, and the situation in this aortoventricular space is quite different from the normal, the compression status with normal breathing. So, but it was our first experience with the CT findings of Nutcracker. And we try to make this angle criteria, but I think it is not a good idea to use that kind of criteria. I think the more practical thing is like this the flow movement of the contrast opacified blood, left renal vein blood into the inferior vena cava. Like maybe we can categorize these into these four categories. The first category is a movement of this contrast opacified left renal vein blood into the same slow speed, like this kind of flow, like this image on the left side. This we do not see any jetting. And the second is because the contrast opacified blood is heavier than contrast non-opacified blood. If the flow is slow, it usually the flows along the bottom of the posterior margin of the inferior vena cava, like this figure on the right side. So if we see this kind of flow or this kind of flow, we can suspect that this is a slow flow and probably Nutcracker. The phenomenon is absent in these patients. But the if we see the flow of along the anterior margin of the inferior vena cava, it means that it's against the natural specific gravity. It means that it's a quite fast flow, and of course, if we see jetting, like the cases we see before, it's definitely indicates that there is a compression. So this basic four category, if we when you see the CT scan, if we look at the left renal vein flow in early phase contrasting NCT, and we categorize the left renal vein flow, one of these four categories, maybe we can suspect the Nutcracker phenomenon if we see this pattern 3 or 4. So this is another patient is gross hematuria, and this is cystoscopy. This cystoscopy shows the bleeding from the left urethral orifice, and this the scroll imaging and the left renal vein flow is definitely along the non-dependent anterior margin of the inferior vena cava, like this. So this is the pattern 3 in this image. This pattern 3, this one, it means that the flow is quite fast, and it indicates the presence of Nutcracker phenomena. So this was a patient with the Nutcracker syndrome with gross hematuria that shows this finding at contrast in ICT. The 50-year-old woman with intermittent gross hematuria, and this is a CT scan. And if we look at this area, aortomesenteric area, probably we can feel the jetting of the contrast opacified blood into the inferior vena cava, like this schematic pattern. And this is a pattern 4 flow. It's strongly indicates the presence of Nutcracker phenomenon. And if this patient does not have any other cause of hematuria, we can make a diagnosis of Nutcracker syndrome causing gross hematuria in this patient. So this is the pattern 1 plug flow, the slow, same speed movement, like this one. This indicates no Nutcracker phenomenon, and this heavier contrast opacified blood flows along the dependent posterior margin of the inferior vena cava, like this. It indicates absent Nutcracker phenomenon, and so we can call this is a plug flow, and this is a sinking flow, and this is the third pattern, and along the anterior margin, and we can see this movement of contrast opacified blood along the anterior margin. This is we can call it a floating flow, and this the last pattern is like a jetting flow, and we see the jetting of contrast opacified blood along the narrow space between the aorta and the supplementary arteries. So it's quite simple, just a 4 pattern. If we categorize the left renal vein flow at early stage CT scan, maybe we can categorize the presence or absence of Nutcracker phenomena. These are more examples of pattern 1, plug flow. So first case, probably you can feel that this is a plug flow pattern 1. And second case, probably you can feel that the same flow speed, same speed flow. And third case, also this is a plug flow pattern. And the fourth case, and this is also the same flow pattern. Probably in the fourth case, probably you can see the movement of the contrast opacified blood from the right kidney And probably you can see that flows along the posterior margin, also along the posterior margin of the inferior vena cava. So all these cases, plug flow pattern 1, and absent nutcracker phenomenon. And the more cases of second pattern, sinking flow pattern, is the contrast opacified blood along the dependent posterior margin. And the first case, probably you can feel this second sinking flow pattern. And second case, you can see the contrast opacified blood along the posterior margin. And the third case, also you can see this movement of the contrast opacified blood along the posterior margin. This is fourth case, also similar pattern. And this is fifth case, similar pattern. And sixth case, probably you can see the movement along the posterior margin. So if you see this pattern at the contrast opacified blood movement, you can suspect that this patient does not have a nutcracker phenomenon. This is a more cases third pattern, so-called floating pattern, movement of contrast opacified blood along the non-dependent anterior margin. First case, you can see that pattern. Second case, you can feel. And third case, also you can see. Fourth case, you can see that pattern. And fifth case, you can see the same flow pattern. So if we see that flow pattern, then we can suspect that there's quite fast flow, and probably that there is a nutcracker phenomenon. And if this patient has some kind of symptom, then maybe related nutcracker syndrome, then we can suspect nutcracker syndrome in those cases. These are forced pattern, let's say, so-called jetting flow pattern. And the first case, you can see the clear jet. I think this is the case we saw in the first part of this talk. And second case, probably you can see a little bit different, but you can feel the jetting in this area. Yes. And the third case is the contrast opacification is not strong, but you can see the similar jetting into the inferior vena cava here. And this is the fourth case. And you can see the jetting phenomenon here. And the fifth case, similar jetting phenomenon here. And the sixth case, you can see the jetting. So I think if we can categorize these four patterns in contrast intensity, maybe we can divide them into the presence or absence of nutcracker phenomenon, and then we can, if we see the patient symptom history, then you can suspect nutcracker phenomenon.
Professor Kim, can I have a question?
Yes, of course.
Regarding the fifth case?
Yes.
Because yes. I don't see a obvious big sign for this case. So big sign is not necessarily detected.
Right. In some cases, even there is no evidence of any compression, but we can see some kind of the pattern 3 or pattern 4 in those cases. The difference is in this patient, we do CT exam with the holding the patient breath, usually in inspiration status. And if we do Doppler ultrasound with patient's respiration, usually in inspiration status, the compression is the weakest. And in the expiration status, the compression is strongest. So if we want to see the left renal vein compression more clearly with this CT, maybe we recommend to do CT scan with the patient at the hold their breath at the expiratory end. Then probably we can see more compression of the left renal vein, and probably can see more of the jetting or the floating flow pattern. But in this Phipps case, I think there's a little bit compression here in between the aorta and the supraventricular artery, and the contrast density in proximal left renal vein is quite strong, but after it passes this aortomesenteric portion, probably the contrast is the density becomes very weak, and it's spread into the inferior vena cava. It's something like when we do retrograde pyrography in cases of the congenital UPJ obstruction, and the contrast in the ureter is the very strong contrast, and when it passes the pinpoint uretrovesical junction, that it spreads into the wide the renal pelvis. It's something like the contrast is spread in this inferior vena cava. It means that there is some the compression point around in this area. In the first talk I think it's prevalence. What the second talk, I mentioned that there is at least three types of nutcracker. Type 1 is a narrowing between the aorta and supraventricular artery. Type 2 is compression by the slightly anteriorly oriented right renal artery. And type 3 is a stretching over the abdominal aorta. So I think if you see this CT, probably that is a type 1 component between the aorta and supraventricular artery. And also there is a right renal artery you can see probably. And in this patient, this portion is compressed by the right renal artery. And so I think this patient is type 1 and type 2 nutcracker. And the spread of the contrast after it passes the compression point by the right renal artery. So I think probably you can feel that, right? This is the right renal artery, right? Right renal artery is slightly anterior directed, and it compresses posterior margin of the left renal vein. So I think this patient has both type 1 component and type 2 component of nutcracker, and you can see the spread of the contrast into the inferior vena cava.
Yeah, I see. Thank you.
Probably you can feel that. Okay.
Yes.
So it's quite simple. And whenever I see the CT scan, I try to categorize this flow pattern type 1, pattern 1, 2, 3, 4, and it has a pattern 3 or 4. I look for the patient, the clinical information and clinical chart, and if there's any symptom that might be related to the Nutcracker syndrome. So basically these 4 patterns. Very simple, but it's a very useful criteria. But still, I think the patient who are not very much interested in Nutcracker syndrome, probably it's not easy to focusing on the left renal vein, even very short time. And so now what we are doing is we collect a lot of cases, these CT cases, and now training the machine, and we may make the AI program for this, categorizing these patterns at contrast in CT, and if this pattern 3 or 4 pattern flow pattern is there, then probably the machine can make a warning to the clinicians that this patient might have Nutcracker phenomenon, and they recommend them to ask to review the patient's symptoms for Nutcracker syndrome. That is what we are doing now. And now another thing, very trivial thing we may see at CT is that this left renal vein flow, main flow is here, but there's a lot of collaterals that are connected to here. So in CT scan, probably we can see the contrast opacified blood from the left kidney, and also contrast non-opacified blood from this the tributary veins. That might be helpful in the detected Nutcracker phenomenon in some cases. In the first case, the left-sided case, probably you can see left renal vein flow here, right? And contrast opacified blood here. And probably if you look at this area carefully, probably you can see this finding. Contrast opacified heavier blood flows along the posterior margin of this left renal vein, and contrast non-opacified blood probably from the vertebral vein, contrast non-opacified blood along the anterior non-dependent margin. It means that heavier blood through the posterior margin and lighter blood, non-heavier blood along the anterior margin. It's very natural thing, and it means that the flow speed is slow. The second case on the right, similar pattern of mixing of contrast opacified blood from the left kidney and contrast non-opacified blood from the vertebral vein. And probably you can see in this area, heavier blood along the posterior margin and non-heavier blood along the anterior margin. So if you see this pattern, probably it means that this flow speed is slow, and probably there's no Nutcracker phenomenon. But in some times, you can see this relation is reversed, like these three examples. And now this area, and contrast opacified heavier blood along the anterior margin, and the contrast non-opacified the blood from the vertebral vein along the posterior margin. So relation is reversed. And on the right, the second case on the right side, similar reversal of relation between contrast opacified heavier blood and contrast non-opacified non-heavier blood. So if you see that reversed relation, probably it means that the fast flow speed is quite fast. That can make this the flow against the natural, the heavier and non-heavier blood flow pattern. So if you see this reversed relation, probably you can suspect Nutcracker phenomenon in these cases, even if there is no evidence of compression between the aorta and the superior mesenteric artery. So the similar cases, the reversed relation between the opacified and non-opacified blood. So basically, we categorize that four flow patterns, and we observe this additional the flow patterns between mixing of the contrast opacified and non-opacified blood, and then we can suggest something to the clinician, like these cases. This is a patient with the follow-up for small adrenal adenoma, and we see, when we see the CT scan, we see this CT pattern, and probably you can feel that something like a pattern 3, contrast opacified blood along the anterior margin. And also you can see the pelvic congestion with the contrast, the regurgitation along the left, the gonadal vein. And then we try to see if this patient has a Nutcracker syndrome, Nutcracker symptom or not. And we found that this patient has the symptom in the medical record. This patient has a right flank pain and left pelvic discomfort and urinary frequency and nocturia. The clinician described that symptoms in the medical record, but did not know what was the cause of these symptoms. And because we see the Nutcracker phenomenon and the pelvic congestion in the CT scan, we suggest that this patient's symptom described the medical record, such as flank pain, pelvic discomfort, urinary frequency, nocturia, might be related to this Nutcracker phenomenon. And we recommend to ask this patient to avoid supine sleeping. If the sleeping habit is supine, and recommend to change the sleeping posture and the kidney Doppler ultrasound to measure the flow velocity in this area and confirm the presence or absence of Nutcracker phenomenon in this patient. And I will talk more on this postural variation of Nutcracker phenomenon next time. And in supine position, this Nutcracker phenomenon is most severe. And so we may recommend ask about the sleeping posture in this patient and recommend the patient to avoid the supine sleeping. And this was a young woman with long history of periumbilical and right flank pain. And 2017, 2019, 2021, and because of this pain, this patient had a CT scan repeatedly. And this was a 2017 CT scan. Probably you can see the pattern 3 or 4, jetting or the flow along the anterior margin in 2017 CT scan and 2019 CT scan. Probably you can see the jetting here. And 2021 CT scan, you can see jetting here. But unfortunately, in 2017 CT and 2019 CT, the radiologist who read this CT scan did not describe anything about this Nutcracker. And this patient, these symptoms were neglected. And this patient has a sleeping habit of supine sleeping and did not recommend anything about the sleeping posture. And in 2021, I saw this CT scan and definitely jetting, and I described this Nutcracker phenomenon and also reviewed the past CT scans and found this Nutcracker phenomenon in the CT scans. And asked the clinician to recommend the patient to avoid supine sleeping, and this patient periumbilical and right flank pain disappeared after she changed her sleeping posture. And if we made a diagnosis in this 2017 and asked the patient to avoid supine sleeping, probably this patient did not have these symptoms during that about 4 or 5 years. So I think this case shows that why we need to see left renal vein a little bit more carefully, and that may help. If we see the left renal vein once, that may help the patient sometimes quite importantly, significantly. And sometimes not this the well-done kidney CT, but the routine abdominal CT, we do not have this early phase CT, early phase contrast enhanced imaging. And in this early phase CT scan, we can clearly see the contrast of movement of contrast specified blood along the left renal vein clearly. But in this routine, the nephropathic phase, delayed phase, the CT scan, we do not see that movement clearly, but faintly we can suspect the left renal vein flow movement in this non-optimal CT scans also. So when we CT scan, even if we do not have this the optimal early phase CT scan, maybe we can the fear, or we can observe the flow pattern in this, even in this non-optimal CT scan. So my recommendation is whenever you see CT scan, and just the look once this left renal vein, and that may be we may find a clue that may help the patient significantly. So, okay, so that is all I want to say today. So basically 4 patterns of flow movement, and the additional the movement of mixing with the contrast of opacified and non-opacified blood. And then if we find the Nutcracker phenomenon in the CT scan, we may recommend the clinician that in our the CT report like that way.